Let's discuss the lower abdominal series. So as you know, based on your assessment, we've determined that you need to train the lower abdominals. Your assessment determined what's the entry point for you. Many people are given low abdominals, but given exercises far beyond their actual skill set. If you've not had your core assessed, then it is a guess. The low abdominals are very important for protecting the spine. We train them using a biofeedback cuff to allow us to develop a more accurate and well-trained functioning core. So why do we go to all the effort of using a biofeedback cuff, and what's the point of training the low abdominals in this technical way when you can see core conditioning classes are all over the place and they do all these sorts of funky movements with the legs? Why don't we just do that? There's several key points we're trying to address. One is to help restore a normal lumbar curve. Your lumbar spine should have a gentle lumbar curve. We don't want it too flat. When the lumbar spine is too flat, it puts a lot of pressure on the front of the spine, and this can lead to problems such as disc herniations and problems like that. Likewise, if you have too deep a lumbar curve, it puts a lot of pressure on the back of the spine and lowers the lumbar facets in the sacroiliac joints. So for whatever the problem is for you, we do need to train lumbar neutral, a gentle curve in the lumbar spine where the pressure is put evenly on the disc, the joints and the facets. And if we walk around with lumbar neutral, it's then fine to bend in and out and extend and side bend around that. But we must restore a lumbar curve. When we use a cuff and we inflate the cuff and we use the numbers, it helps teach that lumbar curve. So when the body wants to do something such as lift a heavy pot in the garden, or throw a ball, or punch a punch bag, or do normal things around the house, it knows what position to go back to. So the more we use the cuff, the more we use the dial, the better your body will get that sense of a lumbar neutral, which is very effective at helping managing back problems. The low abdominal series also helps us strengthen the core in relation to our legs. When we start to move the legs, we have to stabilize that spine so that as the legs, which are very heavy, legs are heavy parts of our body, making up a large percentage of our weight. As we lift the leg, we don't want the pelvis to fall and twist. This creates shear through the lumbar spine. So we're training lumbar neutral. We're also developing strength when we actually lift the pelvis. And it also allows us to develop endurance. So for any low abdominal exercise, we must make sure we've got correct breathing mechanics. So the best way we do this is we start laying on our back and just using the sense of our hands to get feedback of how we're breathing. Let's start with teaching abdominal breathing. For correct abdominal breathing, we need to inhale through the nose, and the tummy actually gets bigger, not smaller. Many people breathe through the chest as they inhale, which is an inverted breathing pattern. That is relying on your neck muscles to lift the chest, and this will create a tendonitis over time. So when we inhale, the inhale mechanism is controlled by your diaphragm. The diaphragm is a dome of muscle here, and it pushes down like this when you inhale. So it pushes down. You've got the pelvic floor and the spine resisting that. So when you inhale and the diaphragm contracts and pushes down, the only place for it to go is forward. So when you inhale, the tummy should be getting bigger. So like this. And when you exhale, there's a recoil of the diaphragm and a contraction of the transverse abdominis, which makes your belly smaller on the exhale. So when we inhale, tummy gets bigger. And when we exhale, tummy gets smaller. If you find this difficult to do, then a good way to practice is to put one hand on the chest and get used to moving this less and less and less, and put the other hand on the tummy. And when you inhale, the tummy, or the hand on the tummy, should be moving up. And as you exhale, tummy gets smaller. So let's start with the first part, which is low abdominal 1, which progresses on from correct abdominal breathing. So this is the mechanism we use for all the low abdominal series. So now we're going to put the cuff underneath the small of the back. So using the cuff, we place the small of the back approximately at the level of the belly button. Okay, we're going to close the valve and we're going to pump that to 40. So as you can see on my dial, I contract, pump that to 40. Then what we're going to do is we're going to use that mechanism. So we're going to inhale through the tummy. And as we exhale, we're going to put a little bit of force. If you can see, that should raise the dial to 70. Okay, you see I should be able to hold that with quite easily. You should be able to hold it at the 70 mark. Now what that is, that basically means my body has the strength, the control and the skill to actually put my spine in lumbar neutral. Your program may show different numbers, the most common of which you'll see is 40/+30, which basically means we pump to 40, then we move the dial via that contraction up to the 70. If it says 40/30, we only go up to the 70, we don't go beyond. If your program has a slightly different number, then you follow that accordingly. So the mechanism is, we inhale, and as we exhale, we get smaller, and that should raise the dial to the 70 mark. Now, low abdominal 1 is that we can control it at the 70 for 10 seconds. And we do that 10 times. So we relax, hold it for 1 or 2 seconds, inhale, tummy gets bigger, exhale, tummy gets smaller. Now in the process of that, as I exhale, the tummy gets smaller, we pull the pelvic floor in slightly. I'm not lifting my chest, I'm not pushing my legs, and I'm certainly not moving the dial by pushing my belly out. We inhale, the tummy gets bigger. We exhale, the tummy gets smaller. And we just go to the numbers on your program. In this case, I'm going to the 70. If your program says 40/30, we don't go beyond that. We do 10 times, 10-second holds with 1 or 2 seconds rest in between. We then have a 45-second rest, and we generally repeat that for 3 sets. When you can contract it to 70, talking and breathing like I am here, then we start to incorporate leg movement, and this is the next stage. So the next part would be we inhale, we exhale, we take it to the 70, and then with a bend in the knee, we start to bring the knees up, and we keep it on that 70, okay? We keep that nice and controlled on that 70. Now you're only bringing the knee to vertical. If you bring the knee further than that, it's going to push on the pad and it's going to throw the dial all over the place. Watch out for some mistakes. If your tummy is getting bigger, you are doing it wrong. Tummy should be smaller. Don't bring your knees further than vertical. And watch for the change of the legs. When most people change the legs, the dial, which might have control, tends to do this. So we want a smooth swapping over. When you can do that, holding it at 70, multiple times as per your program, we then put the legs out further. Once you've achieved that, that means that you have control of your lumbar spine when you're lying down, and most likely when you're generally walking. That's all that means, you're controlling lumbar neutral when you're walking and lying down. We need to progress that further. So the next stage is we would start with the legs in this position. So now we've got no basis of support. We pump to 40, contract to 70, so we go back to that point, I've got to 70. Then we're going to do the reverse. We're actually going to lower the legs with control, and we don't let that dial wobble. Okay, the dial should not be doing this. Conversely, we're not doing a counterbalance. The legs only go from vertical down. As you get better, we're going to add the leverage, and then we're going to build more. Now at some point we should be able to do it with the legs straight, all the way down, all the way back up. But either way, we are controlling this spine. Pump to 40, normally contract up to the 70 mark or whatever it is for you, and we gradually add leg movements, which add more leverage by the legs being further out, and we want to control all the way through. Now what that means is, when you can start doing it quicker with more leverage and you're controlling at 70, then it means your spine is nice and controlled. If you're dancing, when you're kickboxing, when you're at centre parks, playing badminton, at boot camp, flipping tyres. But most people are walking around prone to injury because they have no control of their lumbar spine. And the core, even if it's strong, if it's not actually controlling your spine, controlling your pelvis, then you are putting yourself at risk of injury. So in summary, the low abdominal series is fantastic for teaching lumbar neutral, control of the legs, building strength and building endurance and reducing your chance of injury. Remember, you must have correct abdominal breathing first. When you inhale, whether it's through the nose, through the mouth, the tummy gets bigger, and as you exhale, the tummy gets smaller. When you're lifting, jumping, twisting, your belly should not be pushing out, it should be drawing in, controlling the spine, controlling the pelvis, so your spine can be in the most optimal position possible. Remember the numbers. We tend to start with inflating the cuff to 40, and then depending on your program, if it says plus 30, it means contract up to the 70 mark. Don't go beyond it. Once you can master a low abdominal exercise, we go to the next one. We don't just build up that number. You may have different numbers written in your program, that's fine, but either way, you go to that maximum number, master the exercise, then progress on to the next one, and work your way slowly and methodically through the low abdominal series. The low abdominal series can be very frustrating, but work at it. Use a dial, be very strict on your technique, push yourself, try to go to the next step, but still be strict on the technique. We don't want strong, dumb muscles. We want strong, fit, endurance, and skillful muscles, which actually control your spine, allow you to do more of the things you love, play sports, play with your family, and just enjoy life. So good luck, keep up the hard work. We'll guide you every step of the way, and I'll speak to you soon.